Hi, my name is Brianna Gorman. I will be presenting St. Petersburg, Florida to the audience. I chose St. Petersburg, Florida for this project because it is my hometown, and as a nurse, I would like to be more acquainted with the resources that the city has to offer its residents. Mr. Peter Demons founded St. Petersburg, Florida in 1903 and named it after his hometown of St. Petersburg, Russia. In the early 1900s, spring training was brought to St. Petersburg by the St. Louis Browns. The love of baseball and spring training still reigns around the city. In the 1920s, some of St. Petersburg's finest and well-known hotels were born, such as the Vinoy Hotel. The 1940s brought in World War II troops to Bayboro Harbor for training. More than 100,000 troops and trainees filled the hotels, creating a housing shortage within the city. Today, baseball is still popular to the community as the Tampa Bay Rays, formerly known as the Tampa Bay Devil Rays, call home to Tropicana Field in downtown St. Petersburg. St. Petersburg is known for the downtown city life and the proximity to any of the many beaches. One of the biggest tourist attractions in St. Petersburg is Fort DeSoto Beach. Fort DeSoto Beach has been named the #1 beach in the United States and is named after the historic fort that lies within. The perimeter within St. Petersburg that was studied is mainly made up of single-family houses, apartment complexes, and townhomes. There are many options to either rent or buy a home. Section 8 housing is also available through the St. Petersburg Housing Authority. More than half of the 133,000 homes are occupied by the owner, with the lesser half occupied by renters or left vacant. There are many options for school in the area. To name a few, Westgate Elementary, Dixie Hollins High School, Gulf Coast Christian School, and Northside Christian School. If your child was of middle school age, the resident would have to send them a little bit further than the area that is studied, as there are no public middle schools in the area. The St. Petersburg Library is a little south of the area studied, however it is the closest. They offer a wide variety of services, including reading programs for all ages. They have computer access, a homebound program, a resourceful librarian, and more that is geared towards the surrounding population. The library also teams up with other libraries such as St. Petersburg College. The closest recreation centers are Gladden Park Rec Center and Walter Fuller Rec Center. Both centers offer a variety of activities, including after-school care for a couple hours during the week. There are sports teams, adult classes, and fitness classes offered with varying prices. The city of St. Petersburg is a melting pot of people from all around the world. The majority of the population is those of the Caucasian race, as compared to Pinellas County, with 82.9% Caucasian. According to the Centers for Disease Control, the leading causes for death in Caucasians is heart disease, cancer, and chronic lower respiratory disease. The percent of men and women over 20 years old with hypertension is about 34%, and those with obesity is about 35%. It is shown that persons of higher education levels, along with higher incomes, have lower rates of chronic diseases. There are 2 hospitals in the area, Northside Hospital and St. Petersburg General Hospital. They both offer emergency services. St. Petersburg General Hospital also has a labor and delivery unit. There are a couple nursing facilities in the area that offer memory care units and rehabilitation programs. These facilities offer services for people with and without insurance. However, in nursing facilities, there may be some out-of-pocket expenses. The walk-in clinics that are available take certain insurance plans, but also take cash payments for those without insurance. The Healthy People 2020 objectives the presenter chose for St. Petersburg's community are as follows. Number 1. Reduce the proportion of persons who are unable to obtain or delay in obtaining necessary medical care, dental care, or prescription medicines. By reducing delays in primary care, necessary checkups, and annual dental care, we can reduce the number of emergency visits to either the emergency departments or emergency procedures. Number 2. Reduce coronary heart disease deaths. The majority of the population in St. Petersburg are Caucasian. According to the CDC, as previously mentioned, heart disease is one of the leading causes of death in Caucasians. Heart disease issues are not only leading to heart attacks, however, they can lead to strokes that can be debilitating and/or deadly. Number 3, educational and community-based programs. By educating the community on health issues, risk factors, and how to live a healthy lifestyle, we can reduce the number of people who suffer from obesity, heart disease, and start screening programs to catch diseases early. Early detection of chronic illnesses is key. The parks and community centers located throughout the city are geared towards promoting health and well-being. Kenneth City Park and Walter Fuller offer outdoor fitness areas that have self-propelled exercise machines. The parks have garbage cans, sidewalks, playgrounds, and some offer restrooms and water fountains. The community centers offer indoor and outdoor sports, art classes, after-school care, summer programs. Walter Fuller Rec Center also offers swim lessons and swim fitness classes. The outdoor fitness zones are to promote wellness through exercise. These fitness zones are free and are wheelchair accessible for upper body workouts. The community centers also provide areas for social gatherings and allow rentals of large spaces for gatherings. Kenneth City Fire Department is contracted with Pinellas Park Fire Department for emergency medical services. The fire station is located in the center of Kenneth City, right next to Kenneth City Police Station and Kenneth City Park. The fire department offers free smoke detectors to the community and will aid with the install if needed. Lealman Fire District has been part of the community since 1948. They started as a volunteer fire force and are now all career-based. Their mission is clear: to save lives and protect property. St. Petersburg's water supply is fed from Tampa Bay waters, then filtered through St. Petersburg's treatment and distribution plant. St. Petersburg's wastewater program is constantly being monitored to ensure the safety and effectiveness of the collection and disposal of sewage. St. Petersburg also offers trash disposal and recycling opportunities to its residents for a predetermined rate. The trash collection also offers services to pick up large items for disposal if you request. Recently, News Channel 8 reported that wastewater was being dumped into Tampa Bay waters due to the high rain amounts received with Hurricane Hermine. An investigation found that St. Petersburg had recently closed one of its treatment plants without opening another source for all the wastewater to be diverted to. St. Petersburg City Council claimed they were not aware that the heavy rains would cause for an overflow before deciding to close the water treatment center. In looking for a solution, the city stated that it could take up to 2 years to fix the issue when heavy rains are present. The issue at hand is that the wastewater is going into our beaches, our boating waters, and our fishing industry, creating more algae and bacteria. It is an unsafe environment for citizens and tourists to swim in the water. St. Petersburg's administration includes Mayor Rick Kreisman, Deputy Mayor Dr. Kanika Tomalin, the Mayor's Cabinet, and 8 district representatives. On St. Petersburg's website, there's information on how to email, call, or request the mayor's presence at an event. There are mayoral elections every 4 years, with the next one being in 2018. There are constantly meetings happening behind the scenes of St. Petersburg. Online, there's a schedule of all the meetings and locations of said meetings that will be taking place. Meetings are well attended by residents and are also recorded online for those unable to attend. In June 2016, the city of St. Petersburg dumped at least 2 million gallons of partially treated sewage into Tampa Bay waters. This was due to heavy rainfall and not having the proper storage for the waste. Since closing a water treatment center by Albert Whitted Airport, the city has not replaced it, putting the city and surrounding cities in danger. Not only does the raw sewage go into Tampa Bay, but the manhole covers will start popping up, causing sewage to go into residential areas. This puts residents at risk for bacterial and viral infections. The second community issue is that the only children's hospital in the city is located on the southern end of St. Petersburg. The children's hospital should either be centrally located or have a second one more north. The third community issue is cardiovascular health. As previously mentioned, cardiovascular-related issues are the leading cause of death amongst Caucasians. Early detection programs could aid in lowering these rates. There's a large homeless community in St. Petersburg. The homeless community are at major risk for health issues such as dehydration, malnutrition, and risk of infection. There are shelters throughout St. Petersburg, however, they fill very quickly, putting people back on the streets. Issue number 5 in the community is the lack of sidewalks. Many major roads do not have sidewalks, forcing pedestrians to stand near the road and being at greater risk for injury. The last community issue noted is a lack of health education classes to the public. If early detection is key to avoiding major health issues, then we need to be providing the necessary classes for the people. St. Petersburg's wastewater issues are also happening around the world. Third world countries are often faced with malfunctioning wastewater treatment systems. They use these water to irrigate their crops. The danger in this is that the people are ingesting these crops, oftentimes raw, leaving the disease from the sewage on the food. St. Petersburg has the funds to update their water system. However, Council has decided to use the money on a ferry system to Tampa instead. Studies in Sweden have shown methicillin-resistant Staphylococcus aureus, aka MRSA, in the water treatment tanks. This has raised concerns for humans to be exposed to MRSA via the water they use. Water is precious no matter where you live. It's our lifeline, the way we grow food, the way we dispose waste, how we clean, and so much more. Thank you for tuning in to listen to me talk to you all about St. Petersburg. Have a good day.